Welcome to Oxford Medical Summaries. This is Dr Aziz. I'm a physician who works in emergency medicine, family medicine, and also in research. Concern regarding the MMR vaccine and its relation to autism. Until the pandemic, this was the most prevalent concern out there for those who have expressed concerns about vaccines in the modern age. And even with the concerns with what's going on with the pandemic, this can be seen as the precursor of vaccine hesitancy. And this is it's a great example it's a very good example of how modern media has been used by certain individuals to propagate concerns and to borderline hysteria, and how the greed of a few individuals can cause genuine concerns for countless parents over decades. Now, just to give some basic definitions, autism is broadly defined as a disorder where there are impairments in social interaction, communication, and imagination, often referred to as the triad of impairments, as well as you can often get repetitive stereotype pattern of behaviors. Now, MMR stands for measles, mumps, and rubella. I'm not going to go into detail as to what they are. We can maybe do another session on them, but essentially all three are viral infections. They are potentially contagious. They are potentially fatal. It certainly has killed in the past. And over the years, we have had vaccines which have developed. So, for example, we can see in this graph for measles, the first vaccine was introduced in 1963. And you can see the sharp decline in number of cases of measles. And then again, MMR vaccine, which is a combination of measles, mumps, and rubella vaccine, was introduced in 1971, and you can see a further decline. Now look at the numbers. If you look here on the left, around about 1950s, we're talking about cases of up to close to the million mark. And fast forward 30, 40 years after the vaccines, we're down to zero. And this is, again, part of the psychology of some people not appreciating just because they don't see it, they don't see the visible. We live in a world of instant gratification where we are not concerned about being overweight because the consequences of that are many decades later. We're not concerned about diabetes or high blood pressure because we don't feel the immediate consequences. Now, similarly, just because we don't see measles or mumps or rubella around us, it doesn't mean that this wasn't a problem that was prevented even before it manifested. And these statistics, these are from the health body CDC. These clearly demonstrate that. So again, if we look at the graph so that one's for measles. If you look at mumps, again, look at the numbers in 1950s, 1960s. We're talking about in the numbers of 160, 170,000 vaccines are introduced, and we're pretty much down to zero. Okay, and then again, if you look at rubella, look at the numbers, sky high, vaccines introduced, and bang, 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 down, down, down. And it's almost to the point where several of these in different parts of the World Health Organization has declared as being completely extinct. These diseases did not exist for certain periods of time. But then in 1998, something changed. We had someone by the name of Dr. Andrew Wakefield, a gastroenterologist, essentially a tummy doctor here in the United Kingdom, it's former medical doctor now. He's now struck off, apparently now working in the United States. Interestingly, even prior to the MMR autism controversy, he was involved in controversial claims regarding Crohn's disease, where essentially a lot of research was done afterwards, and the evidence was of such magnitude that he had to retract his claims. This is even before the MMR and autism vaccine. There were a lot of controversies surrounding him, and I might do a separate video going into the detail of this. But essentially what Wakefield did was he published a paper in the Lancet that linked the MMR vaccine with autism. Now, a lot of people have even doctors who presented on YouTube and other places have said, oh, this paper doesn't exist anymore. It does exist. It's still on the Lancet website. I've gone back and I've read it start to finish. It does say retracted, which it is, and which it correctly was done, but there are some categorical statements in there that are, if parents were to even appreciate what the statements were, then they would certainly change their minds about the vaccine, because this guy is essentially the godfather, perhaps that's a wrong term, but maybe false prophet in the sense of when it comes to causing vaccine hesitancy, and certainly the protagonist when it comes to the MMR vaccine and autism. So anyway, in this paper, he highlighted 8 children of parents where the parents reported after the MMR vaccine that there were behavioral changes. Now, the theory that Wakefield postulated, but at no point was ever able to prove, was that MMR vaccine possibly caused measles infection in the intestine, in the gut, which then somehow traveled to the brain, past the blood-brain barrier, and caused neurodevelopmental changes. This was never proven. There's never been any evidence with this. And in the paper, he actually quotes, so again, as I mentioned, I've read through the paper, and in his writing, or in the writing of the authors, he actually categorically states, we did not prove an association between measles, mumps and rubella vaccine and the syndrome described. Virological studies are underway that may help to resolve this issue. Over 20 years later, there have been multiple studies involving millions of subjects that have never proven this. He even says if there is a causal link between measles, mumps and rubella vaccine and this syndrome, a rising incidence might be anticipated after the introduction of this vaccine. This is very smart because vaccines, autism has been on the rise, and what the reasons for that are not entirely clear. It doesn't necessarily mean that the vaccine was the cause of this, and it wasn't the cause of this. And then he categorically goes on to say published evidence is inadequate to show whether there is a change in incidence, i.e. referring to autism, or a link, again referring to autism, with measles, mumps and rubella vaccine. Now bear in mind, this did not in any way prove association, causation. There weren't any real statistics in this study. Wakefield himself admitted as such in his words just mentioned. So how did this gain so much traction? Now, putting an interesting quote by Malcolm X, as you can read here, he once very famously said, the media is the most powerful entity on earth. They have the power to make the innocent guilty and to make the guilty innocent. They control the minds of the masses. Malcolm X. Because this one report, although it did gain some traction in the media, Wakefield then, to the surprise of many of his colleagues and certainly the editor-in-chief of The Lancet at the time, went to the media. He held a press conference. He actually went to America, he traveled to USA, teamed up with a very controversial Republican politician by the name of Dan Burton, who had already made and was dismissed for linking various substances to cancer previously. And they really caught to the media over there, to the point where all major media outlets pretty much, and radio stations and televisions, were now focusing on this. When it gets out to the media, it gets out to the masses, it gets out to parents who are concerned. And unfortunately, despite any proof having existed or being brought to surface that there was a link between the MMR vaccine and autism, parents were now starting to stop giving vaccines to the children, not just the MMR vaccine, but other vaccines. So in the years and even decades to follow, there have been multiple studies spending millions of pounds and heartbreakingly, this time and effort and money that could have been put into actually forwarding progression and finding a possible cure, helping people with autism, that was unfortunately diverted because of Wakefield's report, which it wasn't a scientific study, and it was shocking that it was even published in the Lancet, and certainly something that could never happen in certainly today. Examples of studies that were looked at. So in 1998, Lancet published another study, 500 children, when there was no difference between children who received the MMR vaccine and those who didn't in terms of the incidence of autism. 2002, study published in Denmark, which looked retrospectively at over 500,000 children, over 500,000 between 1991 and 1998, adjusting for variable factors. They found, again, no association between the MMR vaccine and autism. 2002, again, a very similar study looking at over 500,000 children. Now remember, Wakefield's report, because that's what it was, a report, looked at 8 children where the parents said, we think, or we noticed that around about the time they had a vaccine, the MMR vaccine, that they also developed autism. 2005, systematic review was carried out by the Cochrane collaboration. Now, systematic review, you can see here in this picture of the hierarchy of evidence. It's essentially a review of all the possible or a large amount of studies that have been carried out on a particular topic. So essentially synthesizes data across multiple studies. In this case, it looked at 31 studies. And there again, no association between MMR vaccine and autism. 2012, this systematic review was updated. A total of over 14 million children. Yes, you heard that right. 14 million children were looked at, and again, no link between MMR vaccine and autism. And we can keep repeating these studies, we can keep spending more and more money in the face of one report by a discredited, struck off, found to be fraudulent ex-doctor, Mr. Wakefield. But it'll just be wasted money. When you look at millions and millions and millions of case studies, when you do systematic review after systematic review, and there is no connection, we need to start dispelling this myth, essentially what it is, of autism being caused by MMR vaccine. As mentioned, I don't want to just present all the vast amounts of quite categorical evidence which shows that there is no link between MMR vaccine being given and autism and an increase in autism, because that doesn't exist. But here's another way of looking at it. Look at it the other way around. What happened in Japan was, interestingly, after the 98 Wakefield report, they actually stopped giving the MMR vaccine. But what they noticed was, the health authorities there was actually no decline in the rise of autism. As mentioned, there is no questioning that the fact that autism is on the rise and has been on the rise for decades. And I may do a different video on that. Comment down below if you'd like me to comment on that, because again, this is multifactorial. But they said, look, why are we stopping this MMR vaccine? The autism, it hasn't stopped the rise of autism. Why have we stopped this MMR vaccine? It hasn't stopped the rise of autism. There's clearly no association here. And the downside to this, and this is if you're watching this as a parent, listening to this as a parent, a relative, an older sibling, children start falling sick again. Just as mentioned before, just because we don't see measles or mumps or rubella in front of us doesn't mean that if we stop vaccinating it won't come back. And that's what happened essentially. Remember, this report was published in 1998. Children, babies, were the rates of vaccination was going down. In certain parts of the UK, it had gone from 90% down to 70%, to some parts of London even down to 50% because of vaccine hesitancy, because of the hysteria in the media, because of this one report in 1998 on 8 children, which was not a scientific study. In 2002, in a hospital in Dublin admitted 100 children who had been admitted because of measles, which then progressed onto pneumonia, which is a serious chest infection, and brain swelling. 3 of them tragically died. Look at the risks. Let's go through these graphs of measles deaths. Earlier on, we went through the graphs of the cases of measles, mumps and rubella, and how they sharply declined with the introduction of the vaccines. Now look how many deaths there were. We're looking at deaths of in the hundreds, we're going back into the 1950s, and what did the vaccine do? Literally brought it down to a standstill. We're talking about years with 0, 0, 0. And then with the MMR vaccine and the controversy around it, from Wakefield's paper, we started seeing increase again. Mumps, how many deaths did it reduce? Look what it was. Look where the graph was. It reduced it again down to 0 because of the vaccine. Rubella, we had deaths from rubella. German measles, again, vaccines get introduced, sharp decline, going down to 0. So consider the alternative. It's not that you're possibly protecting your child from autism, which you're not, because when studies of in excess of 14 million prove that there is no association between the MMR vaccine and autism, you are essentially putting your child, your relative, at risk of measles, mumps or rubella, which can kill and has killed even here in the 21st century. I hope this at least allows you to realize that we need to move in the right direction. We need to stop channeling money and studies and effort and concern towards what has already been proven, that there is no link between MMR vaccine and autism, and there was never a proven link. Even Wakefield, he said there is no evidence connecting, there is no causality between the MMR vaccine and autism, but he used the media to gain huge amounts of hype and noise essentially, and ultimately that puts children at risk if we do not give them the MMR vaccine. Thankfully, a recent study has shown that over 80% of parents are now accepting that the MMR vaccine is important. So know that you are with the majority, that hype has essentially died down over the last 25 years. Initially it was pretty bad, but do the right thing and get your children vaccinated. Thank you.